This is Red Hot Healthcare. Interviews with today's leaders and all the news that matters. Here's your host, Steve Ambrose.
Hello and great to have you aboard. I'm your host, Dr. Steve Ambrose. For past and upcoming episodes, find us on iTunes and most podcast directories, or on our eye-catching website, redhothealthcare.com. Today's episode is sponsored by Walk the Ridge. We can all have different opinions and views, but when it causes underlying tension and stressful communication, it impacts productivity, management, and even customer results. Walk the Ridge is a fast-growing movement for greater civility. Many people wear and gift our reminder wristbands because they work. You don't have to change your views to be a better communicator with others. Go to walktheridge.org and gift some bands today. If you join for free on our homepage, you'll get up to 15% off for your very first order. Walktheridge.org. That's walktheridge.org. Walk the Ridge, building circles of civility. Seth Serxner is the Chief Health Officer and Senior Vice President of Population Health for Optum Prevention Solutions. He has more than 25 years of experience in health and productivity management and has published more than 40 articles and chapters. He's a national expert on behavior change, program design, and measurement. And Seth, I want to welcome you to the show. I know that you are awfully busy in your day, and we appreciate you taking your time to come on to Red Hot Healthcare.
Thanks, Steve. Happy to be here.
There's a lot of studies that point to the fact that the former model of wellness in the workplace, which was pretty much sold on ROI, didn't really come out with the expected results. I mean, long term now, we're seeing study after study showing that ROI on workplace wellness either doesn't exist or it's controversial. So in your newest white paper called From Wellness to Well-Being, what you state is, quote, wellness transformation is a model that employers invest in as part of their overall business and human capital strategy. Take the audience through the transition, if you could, please, of where wellness has been and then where you see wellness going now and in the future.
Yeah, thanks, Steve, and thanks for the opportunity again. While there have been a couple studies recently that have shown mixed results around wellness, there are dozens and dozens of studies in peer-reviewed journals that do document the impact of well-designed, comprehensive wellness programs on the impact of behavior change, reducing health risks, and on healthcare costs. That said, let's talk a little bit about this shift that you mentioned around wellness to well-being. And what I would say around that, Steve, is that the focus initially on wellness was very much around these lifestyle and behaviors that led to premature health problems and, frankly, to death. And now the shift is in well-being, a study that looks at what are those factors that help people live long, happy lives. And while the research overlaps, things like physical activity in the wellness world were all about cardiovascular health, and in the well-being world, it's all about being consistent, being outside, being social. Other factors like sleep, like financial well-being, mindfulness, all play into a broader well-being state as opposed to a really focused behavioral kind of clinical approach that wellness took at one point. The other piece, just to touch on this, is that shift a bit away from the pure ROI of return on investment from a financial perspective to a broader value on investment perspective. And that value on investment starts to say, are there other things beyond healthcare costs and even absence that can actually help my business grow? Things like if I am, let's say, in the transportation business, do I have more on-time airport departures? Do I have fewer mishandled bags? If I'm in retail, are my store sales better on those employees that have better health? Things like net promoter score or customer service. So we're looking at a whole range of different metrics now as well as a different model.
Yeah, I think the initial views on wellness were, when they focused on ROI, I think they looked at it sort of just as a business practice, and it was a bit myopic. I would agree with you, Seth. It's either Does it work? Is it successful? Is it profitable? Is it going to really cut costs or not? Black or white? And I really appreciate the fact that, this is evolving, as you said. And what we're recognizing is there are lots of different gray areas when you talk about healthcare. It's not just about losing weight or lowering blood pressure, but it's about all those little things like getting enough sleep you mentioned, the things that could add up to depression, anxiety, small cumulative effects that can, I suppose, really affect productivity as well as employee absenteeism and probably even just how engaged you are at work, right?
Well, exactly. So we talk about little e, meaning engaged in programs and services, and big E, engaged in work and life. And what we're finding is that, frankly, organizations that have developed this culture of health, that have more programs, that have more supportive environment, find that their employees are more biggie engaged, that they're more loyal to the company, they're more trusting of the company, they feel like the organization cares about them. So we're finding that, and that's, frankly, to your point, it's hard to quantify that in terms of a pure ROI, but organizations in this competitive environment for labor are really finding that, hey, we want to do other things that really attract and retain our employees and keep them engaged to drive, frankly, better business outcomes.
Let's stay on your white paper, one that I really enjoyed. We're going to have the white paper link on our podcast page as well. You discussed the need for the industry to move in a consumer-oriented model where employees and families are demanding wellness services. Traditionally, I seem to have an issue with this because I think demand is such a strong word and in some ways presumes that people should put health first. And I don't think anybody would knock the fact that health should be put first, but whether you can make the presumption that people are going to put it first. Just because doctors and hospitals tell people they need to check their records, download their records, and make their health very important, communities and consumers, health consumers, don't always oblige, right? They have different values. Square that up for us, if you could, please, in terms of, maybe in your product, what you've seen in terms of like decisioning science or behavior science and how that, really makes a difference.
Yeah, no, the point's well taken. I think when I said demand, what I meant is today, in many ways, we feel like we have to pay people to do things or create a benefit design that really drives them to do something that they, in a sense, aren't really wanting to do, to your point. And what I think we want to get to, and what a consumer point of view is, what's relevant to me? What do I care about? And so this shift to being more relevant, and that to me also is where the well-being factor comes in. People care now more about getting better sleep or, frankly, dealing with their financials than they do about, cooking a really nice meal. At some point, they want to get there. But what's relevant to me right now is I'm exhausted from work and then taking care of the kids and everything else. And frankly, I'm a little stretched financially. And you're asking me to drink 3 glasses of water a day or 7 glasses of water a day. I don't think that's the highest thing on my priority.
Right.
But I'll tell you what, if you can help me straighten out my finances, if you can help me get better sleep, if you can get me a little more resilient and mindful, you wouldn't have to pay me for that. I'd sign up for that. Where do I sign up for that? That's the mindset we'd like to get people to. Part of that has to do with, to your point, this behavior change science. And to me, that's fundamental to the industry. And frankly, also ties to some of our earlier conversation about the impact of programs. There's a lot of programs and services out there, frankly, many of them technology-based, that while they're very good and interesting and maybe even relevant topic, are not grounded in strong behavioral science and behavior change. And to me, part of the whole practice here is to look at the evidence and really incorporate and take that science to practice. Part of that behavior change model has to do with starting, not just jumping right into how do I cook a low-fat meal or how do I train for a marathon. It's why bother? What's in it for me?
Right.
What's my motivation? And that's what we're really trying to tap into here.
Yeah, and let's talk about motivation for a second. The studies out there on the carrot and the stick, the studies are pretty clear that in many cases, employing the stick is going to be greater than the carrot or the reward when you want to, motivate employees or people in general to make a decision. What I haven't seen in population health programs has been the stick. And I'd like to get your thought on that. Everybody wants to be the good guy, the good person, and use rewards with the carrot. Do you believe in the stick? And do you use that in any way with the workplace wellness programs or in any of your services with population health at Optum?
This is a hot topic, Steve. You're absolutely right to bring it up. And it's part of it is in all how you define things. And there's a lot of conversation now about what's, quote, voluntary. So is it a carrot or a stick if the plan design is such that I get 200, 300, the average is closer to $500 or $600 in incentives if I do something. However, if I don't do something, obviously I don't get that money and somehow it feels coercive or a bit of a stick. We have seen designs where people literally will be charged more if you're identified for a disease condition, say diabetes, and we call you and we say, hey, we've identified you as someone who has a condition. We'd like you to work with our nurse a little and help you make sure that you're you know everything you need to know about managing your condition. And if not, by the way, we're going to ding you $50 a month. There have been designs like that. The problem is with a stick, and any of us who have, been around kids and you have the stick, the second the stick goes away, the behavior reverts. The idea is really what we talk about is shifting from incentive design to motivational design.
Yeah.
To my earlier point, let's tap into some intrinsic motivation. It's fine to pay people a little something, to get them motivated. But we know human behavior, and again, from behavioral economics and books like Drive, people really are more motivated by a sense of accomplishment, a sense of inclusion, and by their overall sense of purpose. So we found that tapping into things like social connection, altruism, some friendly team competitions, things that have maybe a group target are much more aligned with this consumerism and less punitive, more around the culture of health, even things like progress-based as opposed to pure outcomes-based. So I would say there are very few employers out there that really want to pull the stick out and in fact have been even rethinking their overall motivational design to be much more aligned with this well-being approach and a large engagement approach.
What you're talking about is maybe not directly employing the stick as a punishment tool, but even in helping patients to find their value points, to make them decide on things, to help them avoid their sticks, so to speak. In other words, if you're talking about finances or something, it's not just giving them a reward or leading to them a reward. It's finding out, what are the sticks in your life and how can we help you avoid it as a motivating force?
I think that's an interesting way to put it. You want to avoid the sticks. So what do you care about? And I will tell you in the world of behavior, when you really boil it down to why people behave they do, most fundamental is avoid pain, seek pleasure. So to your point, we're going to try to help people avoid those sticks, avoid that pain, and frankly, do things that feel good to them and that we also think will help them down the line avoid the sticks.
Yep, absolutely. It reminds me of when I purchased my first Tony Robbins tapes, and I still have my Tony Robbins tapes. And just like you said, Seth, he said avoid pain or get pleasure, the two reasons that people make decisions. And I hear you echoing that. Let's reverse engines a little bit here. And I talked a little bit before about civility. As I see it, that's another area in the workplace that is often undermanaged and underappreciated. But I'd like to just ask maybe a bit more broadly, how do you see workplace culture needing to be improved in order to reduce things such as anxiety, stress in workers? Take me through that end of things.
Yeah, it's so important. So culture has been one of the hot topics now for several years. My father-in-law calls things when they're a win-win. He calls them a twofer. I would call good culture a twofer in that good, healthy culture, which I'll define in a second, drives engagement into programs and services, and in and of itself drives better outcomes. To your first point, though, let's face it, work can be, I'll push it and say toxic sometimes. Work can be hard.
Yep.
That's why we call it work, right? Let's look at our workplace and to whatever extent we can, make it a little less toxic, whether it's giving people more control over how they do things, better interactions with their managers, understanding their role, all those kind of organizational things. Whether it's, to your point, there's a big movement about compassionate workplaces. And this idea that Monica Warland and her colleague wrote a book around compassion that's a business case for compassion. Understanding that people do have pain and suffering that they bring to work, and how do we want to address it as colleagues and as a policy. So the culture that enables people to make healthy decisions, whether it's flex time, whether it's a well-lit staircase, whether it's leadership that really is behind this and supportive. So when you want to take that 20-minute walk at lunch, not everybody else is tied to their desk. Creating that kind of social culture that is very supportive, that organizational culture that has policies that support it, that physical environment, whether it's a stairwell, whether it's a cafeteria, whether it's a vending machines, all these things come together, and there's quite a bit of good tools and resources around how to build a healthy culture.
Today's episode is sponsored by Walk the Ridge. We can all have different opinions and views, but when it causes underlying tension and stressful communication, it impacts productivity, management, and even customer results. Walk the Ridge is a fast-growing movement for greater civility. Many people wear and gift our reminder wristbands because they work. You don't have to change your views to be a better communicator with others. Go to walktheridge.org and gift some bands today. If you join for free on our homepage, you'll get up to 15% off for your very first order. walktheridge.org. That's walktheridge.org. Walk the Ridge, building circles of civility. Seth, one of the latest reports from KLAS, the healthcare IT data and research company, is that worksite healthcare services are absolutely on the rise. I mean, having the doctor and the clinic within the business. You have a interest in this, particularly how it ties into population health. Optum's getting into this space. There are other companies like Care Here and One Medical. I'd like you to talk a little bit about worksite healthcare services and then maybe how that also ties into population health.
We're definitely seeing a growth in that area. Optum, of course, provides those through our MedExpress channel, either on-site or near-site. But what I would say about that is, again, this is part of that whole movement to do a couple of things. One, address the consumer's needs. So make it convenient for me. Also helps the employer because we know time away from work and all those other issues are challenging. And then also, though, to give both the employer and maybe a chance to the provider to deliver those services with more of a consumer orientation, a little bit more of quality of care, a little bit more technology involved. So for us, kind of having a delivery channel as part of our strategy to make the system better for everyone is a big piece of all of this. And so as overall population health strategy, dealing with the continuum from well to at risk to condition to catastrophic, there's certainly a piece of managing that condition as well as some of the prevention that can be met by on-site or near-site services.
Yeah, I remember Brenda Schmidt was on my show last year from Solera, and she said that we want to reach people where they work, play, pray, and stay. And I thought that was such a great cliche. It was just perfect. Let's follow up a little bit on Optum's population health solution. The most recent studies from KLAS show that Optum's solution ranked 9 out of 13. I know this may be a touchy subject. I always like to be kind of even-handed on the show here. So what do you feel like have been some of the issues that have kept Optum's solution from ranking higher? And then maybe talk about some of the changes that have happened since the study where you feel like it has definitely improved and should be posting better results in the future.
Yeah, so Steve, I'm not familiar with this exact study and how they're defining the Optum solutions. What I will say is that we have the broadest suite of services probably out there in the vendor landscape, and we cover everything from well-being services all the way through IT, data warehouse, back-end operations for many health plans, many providers. It seems like a pretty general take. We have made, regardless of that specific feedback, our focus is on what we would call NPS, Net Promoter Score. And what we're really focused on is increasing that across every line of business we have. And so as we develop out whatever it is, whether it's our on-site services, our advocacy services, our coaching, our digital,
Right.
we want NPS to be world-class. And I think that's how we're going to advance ourselves and progress, regardless of whatever rankings people put us at. That's the standard we're holding ourselves to.
I do want to say that study from class, which was the most recent I could find actually, was from 2016. So obviously that's been a little bit time ago, and I just wanted to make that point clear to the audience as well. Let's jump into advocacy services, something that I really like. As I'm like you, I'm very heavy into consumerism, into the leverage that the consumer increasingly has over the healthcare environment. Optum offers advocacy services. The presumption here is there's going to be a greater consumeristic advantage, also for better coordination of more necessary care. Talk a little bit, if you could, Seth, about how the advocacy service is being coordinated with the efforts that you're doing in wellness and population health.
This is a hot topic as well, and per the name of your show. So well done. What I would say is advocacy seems very intuitive, and there are a couple pieces in it from our perspective. One is we really see advocacy as the front door. To make it simple for people, one stop, call the advocate or use your digital device to get in contact with advocacy so that we can deal with whatever's on your mind. And what we find, frankly, is on people's mind are very basic things like, how do I get a new ID card? Am I covered for this? What's the deductible? And then what we can do is say, oh, you need a new ID card? Let me help you with that. And by the way, what's happening? Oh, are you going to the doctor? We see here, because we know the data, that you actually, have been to the doctor before, or, you have some other issues. Do you know there's some additional services around diabetes management? Or do you know that we have some maternity management programs? So the idea here is that in the old days, and we still do this to some extent, reach out to people. We know people don't answer their phone and want to, have us talk to them that way. So them calling us has been a very strong vehicle for engagement. Then, to your point, the advocacy itself is operationalized in a very sophisticated way. So at least in our world, we use intelligent data, intelligent routing. So we know if you've called in before on a clinical issue, we're going to get you right to someone who's clinically expert. For me, though, advocacy is good and important, but it's also a little bit of a Band-Aid into addressing a system that's very confusing, complicated, and, frankly, mystifying for people. And we need to actually make the system better. And then at some point, we won't need at least some kinds of advocacy, and we can have more kind of clinical support.
When we talk about consumerism in healthcare, we think about better experience and more service and better quality. One of the things that we don't talk about is competitive prices. And since for the last 50 years, prices have largely been regulated through third-party insurers, I'd like to get your thoughts as to whether or not you feel that we're going to eventually reach a time where the consumer can expect that as healthcare costs get lower, that those costs will be passed down to the consumers in the form of lower, more competitive pricing.
Such an important question, Steve. And I guess for me, a lot of this boils down to two issues, what I'll call transparency and also this movement around health literacy. The whole idea of having cost transparency and kind of what I was touching on earlier around the advocacy, being able to navigate the system, things like the consumer health plans and the high exposure to costs through high deductibles, we're asking consumers to do more.
Right.
But we're a little bit behind in providing the resources to help them. And frankly, the training and the skills. So for me, health literacy is all about helping people become more skilled and confident in navigating their personal health journeys. And we need to provide the tools and resources to do that. Now, in many cases, we're starting to see really good cost transparency tools. So you can go on, for example, to our tool, our digital tool, and start to see the cost of the provider, the best practice. You can shop around a little bit for things like colonoscopies and other services. And in addition to that, you're starting to get the quality data associated to it. I think that it's accelerating. The speed at which we are starting to provide better and better resources so people can actually be better consumers. And now, frankly, I feel like the other side, which is, hey, great, you're giving me this, let's call it a Ferrari. I barely know how to drive, let alone quite where I'm going. So we need to help people learn how to drive. We need to help them understand where they're going and then how to use these advanced tools that we're giving them.
It's great that we have price transparency and it's getting stronger, but the prices are still set. In other words, you can't go around and you can't shop around for an MRI. You can't shop around for lab tests. I mean, you can go on United Healthcare or Aetna's site and perhaps maybe in the future see, well, if I go to this doctor, their contracted rate is lower than this doctor. But it's not like that you can have the providers or the drug companies actually competing on price. You see where I'm going with this? I mean, it's not really true price competition. The prices are still being set by the third parties.
I think that's probably true and will take a while. I mean, we know the government through Medicare, and other vehicles sets the stage for some of that. So for example, to your point about shopping around, as the consumer behavior changes and more people go to those providers with higher quality and frankly lower cost for, we'll call it diagnostics or for, some of the things that they can choose to go to, the pricing and the behavior will change. We're already seeing some of that. But I think the unit cost price is very challenging still. I would agree with that.
Not to get too much on topic, but I really see more health systems, as I've been talking with my guests. Many of them are looking at a higher volume model. Not higher volume to replace value in the sense of just billing and billing and billing like fee for service, but sort of a model of saying, okay, we're a health system now with 13 hospitals. How can we grow to be 50 or 100 hospitals? How can we use telehealth? How can we control larger patient populations locally where we have facilities and maybe through partnering remotely where we can connect with people and sort of acquire these patients? I think when it's all said and done the next 10 years, we're going to see that controlling patient populations, and not in an evil way, but being able to actually have larger volumes of patient populations may open the door to more competitive pricing down the road.
Yeah, that may be the case. We're definitely seeing some shifts in how hospitals are going about their business models, more outpatient, more virtual, more technology with remote communications. I think the next 10 years will be very interesting.
Seth, often I'll ask the guests of mine a left field question, and so I won't disappoint here. What's a favorite book of yours that is not a healthcare book and not a business book, but that's made a big difference in your life?
Yeah, that's a fun question. So thanks for letting me think about that a little bit. I would say, the most recent, Steve, I like to travel. And recently I took a personal trip to India. And to prepare for that trip, I read a book called Freedom at Midnight by Collins and LaPierre. And it's really about kind of the British occupation of India and then the partition of India into India and Pakistan. And obviously Gandhi played a very strong role in that period. But to me, it was very enlightening about the Hindu-Muslim cultures, the influence of British colonization, and then when they left, how to kind of further that. So to me, that was very historical, but very, very interesting, and a lot of profound philosophy in there. And I really enjoyed it. And they're terrific authors that people may be familiar with.
Seth Serxner, Chief Health Officer and Senior Vice President of Population Health at Optum Prevention Services. Seth, I want to thank you so much for coming on the show. Great talking with you. I know we've been teeing this up for a long time, and I'm glad we could make it happen, and I'm really glad you could share your thoughts with our audience.
Thanks, Steve. I really appreciated the opportunity.
You've been listening to Red Hot Healthcare with Steve Ambrose. Subscribe to us on most major podcast directories. For media or business inquiries, reach out to media@redhothealthcare.com. Thanks for listening. This is Denny Colonna. We're out of here.